You get the test results back. The number looks normal, but you still feel drained, foggy, and nothing like the man you used to be. The problem might not be you. It might be the test itself. A few simple mistakes, especially for men over 60, can make your results completely inaccurate. In the next 20 minutes, I'll reveal the 5 most common errors and give you a simple checklist to ensure your next test tells the real story. You are here because you are serious about vitality. Accurate testing is the cornerstone of mastering your health. Without a true baseline of your testosterone, any treatment plan is just guesswork. We need to eliminate the confusion and the wasted time. Every single year, thousands of older men get tests that lead to wrong diagnoses or missed opportunities for improvement. The simplest mistake often happens before you even walk into the lab. Mistake number 1 is Doppler testing at the wrong time of day DOP. Your testosterone levels are not static. They follow a strict 24-hour cycle. This is called the circadian rhythm. Your body's T levels peak sharply in the early morning. They begin dropping immediately after you wake up. For a young man, that afternoon drop might only be 20%. But for a man over 60, that morning surge is often less pronounced and much shorter. This means the drop is far more critical. Testing at noon, or worse in the afternoon, will almost certainly give you a false low reading. This is not your true baseline. It is simply the lowest point of your day. If you want a number that accurately reflects your body's maximum T production, you must get your blood drawn between 7 a.m. and 9 a.m. 8 a.m. is the gold standard. That 2-hour window is non-negotiable for an accurate reading. If your doctor allows you to test later in the day, they are wasting your time and your money. Insist on that early morning appointment. This single factor can change a low T diagnosis to a normal reading instantly. Always test within the peak window. Subscribe now if you are ready to take professional control of your health data. Next, timing is crucial, but what happens when you get the timing right and the results still don't make sense? That leads us directly to the second critical mistake. Mistake number 2 is not getting the full panel NOST. Most doctors, due to standard protocols or insurance limitations, will only order a total testosterone test. They are checking the size of the whole workforce. They are looking at the total amount of testosterone floating through your bloodstream. The problem? Most of that total T is useless. It's tied up and inactive. To truly understand what your body is doing, you need to look at 3 specific numbers: total testosterone, free testosterone, and sex hormone binding globulin, or SHBG. Think of total T as all the workers you hired. Free T is the small percentage of workers actually on the job, doing work for your body. SHBG acts like a powerful glue. It grabs the testosterone and locks it away, making it unusable. As men age, SHBG naturally increases. This means your total T might look decent, but the SHBG is holding all of it hostage. This is why you can feel the symptoms of low T even with a normal total T score. Your body isn't accessing the hormone. When you go to your physician, you must specifically request the comprehensive panel. Don't leave it to chance. The total T number is only the start of the story. The free T and SHBG provide the necessary context. They tell you how much of the hormone is biologically active and available for use. This critical information changes treatment decisions entirely. Getting the full panel is essential for diagnosis. What if you've done the early morning draw and requested the full panel, yet your results still look inexplicably low? The answer is often found in the 48 hours leading up to the test. Mistake number 3 is ignoring short-term factors. Many temporary lifestyle factors can crash your T levels and give you a wildly misleading result. The most common factor is sleep. A single night of poor sleep can significantly depress your morning testosterone peak. Chronic sleep debt is even worse. Hormones do their heavy lifting while you rest. If you are testing after a night of insomnia or travel-related exhaustion, your test result is not your true baseline. Another powerful factor is alcohol. Even moderate consumption the night before can suppress hormone production. For men focused on long-term vitality, we advise zero alcohol for at least 48 hours before the test. You need your liver and endocrine system operating at peak neutrality. High-intensity exercise is also a temporary variable. A marathon run or an exhaustive heavy weightlifting session 24 hours before your draw can temporarily spike cortisol and decrease T. Stick to light walking or rest on the day before the test. Finally, illness matters. If you are battling a cold, a fever, or even severe allergies, your body is prioritizing immune response. This temporarily lowers T production. Wait until you have been symptom-free for at least 1 week before testing. You must create a neutral environment for the test. Your 48-hour prep checklist should prioritize rest, abstinence from alcohol, and light activity. Now let's talk about the testing methods themselves. Not all samples are created equal. Mistake number 4 is using the wrong type of test. In the age of convenience, many companies promote at-home testing kits. These often use saliva or dried blood spot samples. While these methods are easy and can provide general trending data, they are absolutely not the clinical standard. If you are trying to confirm a low T diagnosis or determine eligibility for treatment, saliva and dried blood samples are problematic. Saliva testing measures free testosterone, which sounds useful. However, these results can be easily contaminated by certain foods, dental hygiene products, or even variations in saliva production. They lack the precision required for serious medical decision-making. The gold standard, the only method your doctor and labs rely on for clinical accuracy, is the serum blood test. This is the standard blood draw from a vein in your arm. Serum testing provides the most stable and reliable measurement of total T, free T, and SHBG. It's the benchmark against which all other methods are measured. For men over 60, precision is paramount. We are looking at small changes that have large health implications. Avoid the temptation of a cheap, quick test that delivers an unreliable number. When you schedule your test, ensure the order specifies a serum blood sample. If a provider tries to diagnose you solely based on a saliva test, Seek a second opinion. Now, imagine you've meticulously followed all 4 steps. You tested early, you got the full panel, you prepared your body perfectly, and the number comes back low. You might be tempted to jump immediately to treatment. That decision is too fast. It brings us to the most overlooked mistake of all. Mistake number 5 is only testing once. Hormones are not concrete, unchanging statues. They are dynamic and fluctuate based on stress, season, sleep, and many other factors. A single low reading might just be an anomaly. Perhaps you had a highly stressful meeting the day before. Maybe you had a minor viral illness you didn't even notice. Basing a potentially life-changing decision like starting testosterone replacement therapy, or TRT, on a single data point is poor medical practice. To confirm a true chronic deficiency, you must confirm the low reading with a second test. This secondary test should be performed 4 to 6 weeks after the first. This gives you time to normalize any temporary variables. It allows you to ensure the symptoms are persistent and not merely situational. If both tests show consistently low numbers within the early morning window, and if those numbers align with your persistent symptoms, fatigue, brain fog, loss of drive, then you have a diagnosis confirmed by evidence. This 2-step confirmation process is key. It ensures you are not committing to therapy or pursuing expensive lifestyle changes based on one fluke reading. Always confirm a low reading. These 5 mistakes are the reason many men feel unheard or misunderstood by their medical providers. Let's review the simple checklist you should use to get your real story. First, confirm the appointment time is 7 a.m. to 9 a.m. Second, ensure the order specifies a complete panel, total T, free T, and SHBG. Third, implement a 48-hour protocol of deep sleep, no alcohol, and light activity. Fourth, insist on a reliable serum blood test. Finally, if the result is low, confirm it with a second test in 4 weeks. The power here is in preparation. This preparation moves you from being a passive patient to an informed partner in your health care. This is what Gentleman's Vitality is all about. If you value this kind of actionable, evidence-based strategy for boosting your vitality, please take a moment to subscribe. We cut through the noise every week to deliver exactly what you need to master your health. Taking control means knowing your numbers are true. Once you have an accurate reading, you can start the real work of restoring your energy and vigor. You are serious about controlling your health. Start by controlling your data. The question many men have after seeing their results is about those reference ranges. If your total T comes back at 350 nanograms per deciliter, your doctor may tell you that's normal. This is one of the most confusing aspects of hormone testing, especially for men in our demographic. We need to address the idea of the normal range. The reference range provided by the lab is an extremely broad statistical average. It is often based on the population of all adult males, sometimes ages 18 to 90. The low end of that range, say 300, might be considered normal for a 75-year-old with multiple health conditions. But if you are a healthy 62-year-old with severe fatigue and drive issues, a 350 is likely suboptimal. The normal range is designed to catch severe clinical deficiency. It is not designed to define optimal health or vitality for an aging man who wants to remain active. We are not just aiming to be not sick. We are aiming for peak vitality. Your goal should be to align your testosterone levels with your specific symptoms. If you are feeling great and your T is 350, that might be your normal. If you are exhausted and your T is 350, that number is too low for your body to thrive. Work with your physician to aim for an asterisk optimal range, often in the higher tier of the reference range, while monitoring your symptoms closely. The number should always be interpreted through the lens of how you actually feel. Do not let a single normal lab result dismiss your very real symptoms. Another common point of confusion comes from supplements. Many men are taking over-the-counter T boosters when they decide to get tested. These products often contain ingredients like DHEA or specific herbs. If these supplements artificially inflate your T levels right before the test, you are not getting your true baseline reading. You are masking the real problem. If you suspect you have low T and are considering testing, you need to remove most non-essential hormone-influencing supplements for at least 2 weeks beforehand. This ensures the reading reflects your body's natural output, not a temporary spike from a proprietary blend. Once you have a clear, accurate baseline, then you and your doctor can decide on the best intervention, whether that's targeted lifestyle changes or a formal treatment plan. This process begins with reliable data. Remember, the goal of this preparation is honesty. You want your test to be an honest snapshot of your body's current state. Any interference, whether it is late-night alcohol or a powerful supplement, distorts that picture. Be disciplined in the lead-up to your test. Your long-term health depends on it. This is how you reclaim control and transition from managing decline to actively pursuing strength. This is how you live a stronger, healthier, and more vibrant life. We've covered the 5 core mistakes and the crucial concept of optimal ranges. But let's quickly address 2 final practical questions that always come up with our viewers, specifically targeting the men over 60 who might be dealing with other medications or chronic conditions. First, the impact of existing medications. Many common drugs can influence your T-test results. Statins, which are widely used for cholesterol, and certain opioid pain medications, for example, are known to suppress testosterone production. Even some anti-anxiety and antidepressant medications can shift the balance. You must provide your physician with a complete, up-to-date list of every single supplement and prescription drug you are taking. Do not stop taking any prescribed medication without direct consultation with your doctor. The point here is awareness. If your T level is low and you are on a known T-suppressing drug, that context is essential for diagnosis. Your doctor needs to weigh the benefit of the necessary medication against the hormonal side effects. The second common question is about the role of obesity and chronic inflammation. For older men carrying excess weight, especially abdominal fat, that fat tissue actively converts testosterone into estrogen. This process, called aromatization, not only lowers your total T, but also raises your estrogen levels. High estrogen can mimic some of the symptoms of low T, complicating the diagnosis. If you are significantly overweight, your T-test should be accompanied by an estradiol test. This is often included in the comprehensive panel we discussed earlier. It provides the full picture of your sex hormones. Weight loss, especially targeting visceral fat, can naturally reduce the aromatization process and may lead to a subsequent increase in your natural testosterone levels. It is one of the most powerful drug-free ways to influence your hormones. Understanding these mitigating factors ensures that your T-test is not just a number on a page, but a tool for comprehensive health evaluation. It guides you toward lifestyle changes that truly matter. Getting an accurate test is the first victory. Using that accurate data to inform smart decisions is the ultimate win. Take this list of 5 mistakes, review your lifestyle, and book your test with confidence. Remember, every step we discuss on Gentleman's Vitality is about empowering you to take control. We cut through the complicated science and give you the actionable checklist. Do not settle for feeling merely normal. You deserve to feel optimal. Like this video if you are ready to apply these strategies to your health routine. If you commit to this level of preparation, you guarantee that the money and time you spend on testing will yield meaningful, actionable data. You will finally move past the confusion and onto the path of real solutions. We have navigated the pitfalls of testing and the importance of optimal ranges. Now, let's bring this full circle with a final emphasis on why this attention to detail matters so much for men over 60. This demographic faces unique challenges. We are often managing multiple health issues. Time is precious, and energy is not unlimited. We cannot afford to waste months or even years chasing vague or inaccurate diagnoses based on flawed testing. A false low T reading might lead a man to unnecessarily start replacement therapy when better sleep was the real issue. Conversely, a falsely high or normal reading might cause a doctor to overlook a treatable condition, leaving you to struggle with fatigue and low drive unnecessarily. Accuracy breeds confidence. When you know your numbers are true, you can advocate powerfully for your health. You can walk into your doctor's office and say, "I conducted this serum test fasted at 8 a.m. after a full week of optimal sleep, and my free T is still 7. I need to discuss evidence-based options." That kind of specific, informed presentation commands respect and yields better outcomes. Think about the longevity benefits. Testosterone is not just about libido or muscle mass. It is fundamentally linked to bone density, cardiovascular health, and cognitive function. Maintaining healthy hormone levels is a pillar of wellness as you age. It supports your mobility and protects your mind. Ensuring your test is accurate is, therefore, a foundational act of long-term self-care. It's an investment in your strength and vitality for the next decade. This channel, Gentleman's Vitality, is dedicated to helping you master your health, not simply manage decline. The strategies here, the 7 a.m. blood draw, the full panel request, the 48-hour prep, are the professional standard. They are the same steps used in specialized men's health clinics. You now have the checklist of the experts. Apply these lessons. Eliminate the guesswork. Demand accurate data. When you do this, you reclaim control over your own health trajectory. Subscribe if you haven't already, so you don't miss our upcoming deep dives into optimizing sleep, nutrition, and mobility. We are here every week to help you live stronger, healthier, and more vibrantly. Thank you for watching. Now that you have the tools to get the most accurate T-test results possible, let's look forward. What should you expect after you've confirmed your numbers? If your total and free testosterone levels come back consistently in the optimal range, congratulations. This means your energy and vitality issues are likely stemming from one of the other pillars of health: sleep, nutrition, or mobility. The accurate test has eliminated hormones as the primary suspect, allowing you to focus your attention and your doctor's attention on other potential causes, such as nutrient deficiencies, sleep apnea, or high chronic stress. The value of the accurate test here is redirection. It prevents unnecessary hormonal intervention. If, however, your confirmed numbers are truly low and they correlate strongly with your symptoms, you and your doctor can move forward with confidence. The data is solid. You can begin discussing science-backed options. For many men, the first line of defense remains optimized lifestyle. We are talking about targeted resistance training, maintaining a healthy weight, and ensuring impeccable sleep hygiene. These foundational efforts can often raise T levels significantly, particularly in the suboptimal range. But for those whose levels remain clinically low despite optimal lifestyle efforts, your accurate test results are the ticket to exploring replacement therapy. This conversation must be comprehensive, discussing all available delivery methods, injections, gels, pellets, and balancing the benefits against the risks. A low T diagnosis is not a life sentence of fatigue. It is a sign that a specific biological process needs support. The crucial difference here is the confidence level. You are not saying, "I think my T is low because I'm tired." You are saying, "My verified data confirms my low T, and here is how we move forward." This empowers you in every health dialogue. Remember, we are focused on longevity and vitality. The objective is to use this information to maintain strength, protect your cardiovascular health, and keep your mind sharp. An accurate T-test is the entry point to that entire discussion. It's the key piece of evidence that unlocks a better health future. Do not underestimate the power of starting with a mistake-free test. Take action today. Schedule your appointment and commit to the 7 a.m. window.